Propranolol is a time-tested heart medication that not only tackles high blood pressure and irregular heartbeats, but also helps with anxiety and migraines. In this video, I will explain everything you need to know, including side effects such as fatigue, dizziness and lightheadedness, and the potential risks associated with taking it. I will answer some frequently asked questions in my clinic, such as will it affect my sex life? Will it make me put on weight? How does it compare to other heart medications? So let's get started with what is propranolol. It belongs to a group of medicines called beta-blockers. It's used to treat heart problems, help with some of the symptoms of anxiety, and prevent migraines. If you have a heart problem, you can take it to treat high blood pressure, treat conditions that cause an irregular heartbeat like atrial fibrillation, help prevent future heart disease, heart attacks and strokes, and help prevent chest pain caused by angina. It can also help reduce your symptoms if you have too much thyroid hormone in your body called thyrotoxicosis. You'll usually take it together with medicines to treat an overactive thyroid. This medicine is only available on prescription. It comes as tablets, slow-release capsules, or as a liquid that you swallow. So how does propranolol work? It's a beta blocker, so it works by changing the way your body responds to some nerve impulses, including in the heart. It slows down your heart rate and makes it easier for your heart to pump blood around your body. It works differently if you're using it for anxiety. When you are anxious, your brain makes chemical messengers called adrenaline and noradrenaline. These make your heart rate faster and make you sweat or shake. Propranolol helps block the effects of these chemical messengers, so this reduces the physical signs of anxiety. It's not fully understood how propranolol prevents migraines. It may work by relaxing the blood vessels involved or by reducing activity in the visual cortex. This is part of the brain where migraines are believed to start. So who cannot take it? It's not suitable for everyone, so to make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to propranolol or any other medicine. If you have low blood pressure or a slow heart rate, if you have heart failure which is getting worse, have ever had depression or had thoughts about harming yourself, if you have diabetes, if you have liver or kidney problems, if you have severe blood circulation problems in your limbs such as Raynaud's phenomena, which may make your fingers and toes tingle or turn paler than usual, or turn the color blue, have metabolic acidosis when there's too much acid in your blood, if you have lung disease or asthma, if you are pregnant, trying to get pregnant or breastfeeding. So what are the different types of propranolol? Propranolol comes as two different types of medicine. A standard release formulation. Now these tablets release propranolol into your body quickly, so you may need to take it several times a day depending on your dose. Or a slow release formulation. These capsules release the medicine slowly, so you don't have to take it as often. Once a day is usually enough. If you are taking it once a day, your doctor may advise you to take your first dose before bedtime because it can make you feel dizzy. After the first dose, if you don't feel dizzy, you can take it in the morning. So what's the dose? The standard release tablets come in strengths of 10, 40, 80 or 160 milligrams. The slow release capsules are 80 or 160 milligrams. The liquid comes in strengths of 5, 10, 40, 50 in 5 milliliters. How much you take depends on why you need propranolol. The usual doses for adults with high blood pressure is a starting dose, which is usually 80 milligrams taken twice a day. If this dose isn't working well enough to reduce your blood pressure, your doctor may increase it to a maximum of 160 milligrams twice a day. For migraine or chest pain called angina, it's 40 milligrams taken 2 or 3 times a day. This can be increased to 120 to 240 milligrams a day, and this dose is usually split over the day. For irregular heartbeats, 10 to 40 milligrams taken 3 or 4 times a day. For anxiety, 40 milligrams taken once a day, which can be increased to 40 milligrams taken 3 times a day. If you have too much thyroid hormone, it's 10 to 40 milligrams taken 3 or 4 times a day. Now, doses are usually lower for people aged over 65 or people with kidney or liver problems. So how do you take it? Propranolol doesn't usually upset your stomach, so you can take it with or without food. It's best to do the same each day. Now, swallow the tablets whole with a drink of water. If you find the tablets difficult to swallow, some brands have a score line to help you break the tablet in half. Check the information leaflet for your brand to see if you can do this. If you're taking capsules, swallow them whole with a drink of water. Don't break, chew or crush them. So what do you do if you take too much and the risks of overdose? Propranolol overdose is extremely serious and can cause severe symptoms such as slow heart rate, feeling dizzy or shaky, seizures or fits, breathing difficulties, and even cardiac arrest. A case involving a 24-year-old woman who overdosed on propranolol and an antidepressant highlights its dangers, as she sadly passed away despite emergency efforts. Peak effects of propranolol occur within 1 to 2 hours of taking it, and it crosses the blood-brain barrier, increasing the risk of convulsions compared to other beta blockers. You must seek immediate medical attention at the hospital emergency department to reduce the risk of any fatality following an overdose. So what are the common side effects? Headaches, feeling tired, dizzy or weak, cold fingers or toes, feeling or being sick or diarrhea, stomach pain, sleep disturbances or nightmares. So what are the serious side effects? Now tell a doctor straight away if the whites of your eyes turn yellow or your skin turns yellow or you have pale poo or dark pee. These can be signs of liver problems. If you get nosebleeds that last for more than 10 minutes, unexplained bruising, or you bruise more easily than usual, these can be signs of low numbers of platelets in your blood. And go to the emergency services if you have shortness of breath with a cough which gets worse when you exercise, like walking up the stairs. If you get swollen ankles or legs, chest pain, or an irregular heartbeat. These are signs of heart problems. If you have shortness of breath, wheezing, and tightening of your chest, these can be signs of lung problems. And in rare cases, propranolol may cause a serious allergic reaction. Now, these are not all the side effects of propranolol. For a full list, see the leaflet inside your medicines packet. So what are the cautions with other medicines? There are some medicines that may affect the way propranolol works. So tell your doctor if you're taking other medicines for high blood pressure. The combination with propranolol can sometimes lower your blood pressure too much. This can make you feel dizzy or faint. If this keeps happening to you, your doctor may change your dose. If you're taking other medicines for an irregular heartbeat, such as amiodarone or flecainide. If you're taking other medicines which can lower your blood pressure, these include some antidepressants, nitrates for chest pain, baclofen, medicines for an enlarged prostate like tamsulosin, or Parkinson's disease like levodopa, or if you're taking medicines for asthma or COPD, if you're taking diabetes medicines, particularly insulin. Propranolol may make it more difficult to recognize the warning signs of low blood sugar. Speak to your doctor if you have low blood sugar levels without getting any of the usual warning signs. check your blood sugar after exercise and follow the usual advice about checking it before driving, cycling, or operating machinery. If you take medicines to treat nose or sinus congestion or other cold remedies, including those you can buy in the pharmacy. Medicines for allergies such as ephedrine, noradrenaline, or adrenaline. Or non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, diclofenac, or naproxen. These medicines may increase your blood pressure, so it's best to keep them to a minimum. So what will happen if you stop taking propranolol? Now, if you want to stop taking it, talk to your doctor, because if you're bothered about some side effects, your doctor may be able to prescribe a different medicine instead. Stopping propranolol suddenly may make your health problem worse. And if you stop suddenly, after taking it for a long time, you may get extra side effects as a reaction to stopping it. These include irregular heart rate, sweating, and shaking. And if you stop taking propranolol, it will take about 1 to 2 days for it to be completely out of your body, but the side effects can last up to 1 week. So can you drink alcohol whilst taking it? Drinking alcohol can increase the blood pressure lowering effect of propranolol, which can make you feel dizzy or lightheaded. During the first few days of taking it, or after an increase in your dose, it's best to stop drinking alcohol until you see how the medicine affects you. If you find it still makes you feel dizzy, it's best to stop drinking alcohol. And will it affect your sex life? Now, some people on propranolol say that their sex drive goes down, and some men find they cannot get an erection. This is more likely if you are on a higher dose of propranolol. So if you're having problems with your sex life whilst taking propranolol, I would talk to your healthcare professional about it. Another question I'm asked is, will it make you put on weight? Some people on propranolol do say that they put on weight, especially in the first few months of taking it. Now, it could be, for example, because propranolol can make you feel tired, which could make you less active. It could also affect the way your body uses energy. So how does it compare to other heart medication? Propranolol works as well as other beta blockers for reducing blood pressure. The main difference between it and other beta blockers is that it doesn't just affect your heart, it can affect other parts of your body too, like your lungs. Sometimes you may have to try other blood pressure lowering medicines if you get side effects. So many people need to take a combination of different medicines, and there are lots of other medicines to lower your blood pressure and to treat chest pain. They work in a different way to beta blockers, and these include ACE inhibitors like lisinopril, angiotensin receptor blockers like losartan, calcium channel blockers like amlodipine, and medicines that make you pee more called diuretics, for example furosemide. Now, if you would like to learn more about lisinopril, losartan, or amlodipine, I will leave links down below. And do remember that beta blockers are not usually the first choice for high blood pressure. The medicine your doctor prescribes depends on your age and ethnicity. Now, I do hope you enjoyed this video, and please share your thoughts or experiences in the comments section, and like and subscribe so you get notified when a new video is released every week. You can also watch my other videos or playlist to be fully informed on your medication. Thank you for watching, and see you in the next video.